Application on the foot can be done with different applicators depending whether the application targets a large or a small surface. In this video is only shown an application with the 15mm tip. The treatment can be applied on a single spot or over larger surfaces by gliding the applicator over the target tissue. You can use manual counter pressure to stabilize the handpiece during application. Be sure to have placed enough gel on the tissue. Here we are applying the treatment towards the toes, but gel is already positioned in the middle of the foot. It will enable a fluid treatment. Application on spheric body parts like the heel can be provided using circumduction around the painful point. The handpiece should remain perpendicular to the tissue at all times.